Hey everyone, this is Michael Link at Apt Associates and a proud 30+ year member of AAPOR. I have a question for you. Are you staying at home as much as possible? Have you been self-quarantining, that is staying at home and avoiding contact for more than 14 days? Did you go out yesterday? If so, for how long? Why did you go out yesterday? We've heard terms such as lockdown, quarantine, shelter in place, and stay at home. These aren't new concepts, but in the context of the COVID-19 pandemic, they really do start to take on new meaning. Can be somewhat tricky for us as survey researchers to try to measure these important concepts accurately. So one of the things that we did was look at this by gathering about 1,200 different questions, part of an ongoing study that we have that are related to COVID-19 that have been published and are publicly available by various AAPOR associates, whether they are in universities or in various agencies. But these are questionnaires that fielded between February 15th and April 15th. We've coded those and we pulled out the ones that look like they were related to staying at home and did a little bit of analysis on those. When we looked at these questions, we found that we could really group them into three basic areas for kind of understanding. The first is what we might think of as in terms of a relative framework. That is, the phrasing of these questions and the question options are really quite general. There's really no reference point per se. Rather, each respondent frames the question within his or her own experiences. For example, are you staying at home as much as possible? Yes or no? A question without an objective reference point does make it a bit trickier for us to be able to understand exactly what it is that's happening. And it really does affect the interpretation of the question for us, as the responses can really vary dramatically based on various experiences of the respondents. Second area of questions, we might call those that involve a qualifier or some type of reference. These are questions that are associated with options that provide really a mental anchor or an objective reference point for the respondent. This may include a date, such as, have you gone out in the last 7 days? Or it might specify conditions under which an individual is staying home now when they otherwise might not have. For instance, have you stayed at home instead of going to work or to school or doing other types of activities? The specificity within the questions helps the respondent to frame and interpret and respond to the question in much more of the same manner across respondents. Which results in findings that are a little bit more, I think, easily understood and communicated and analyzed. Finally, we have a third set, which captures what we might say more detail on this particular concept. And it's typically looking at treating the concept as having multiple dimensions and leveraging multiple questions to look at those dimensions. As shown in the example here, a question such as, did you go out yesterday? If you did go out yesterday, then how long did you go out? How many hours were you gone? What were the specific activities that you took part in as you were out yesterday? As you can tell, that this starts to give us more of a specific focus for the respondent. It gives us a richer set of contextual data for understanding the scope of the activities in more clarity. These types of more detailed measures are really of greater use for really understanding some of the critical types of things that are happening, whether folks are adhering to the stay-at-home orders, how it is that perhaps social interaction is leading to increased spread. And these are the types of questions that you would leverage as well with trying to contact trace individuals. As we all know, public opinion can really provide some fantastic information and much needed information here during the COVID pandemic. There are a lot of things that, while they seem familiar, are actually quite new in this unique context, and survey researchers are then kind of challenged to help be able to frame these particular questions. So we're making sure that we are accurately capturing the type of information that we want and need. As we all know, though, insightful information, which helps to drive action, is really a critical component for helping to curb this pandemic by being able to help individuals make decisions with data, marshal resources, and help those in need. I really want to thank you guys for taking out some time, and you all stay safe out there. Thanks much.